I am Dr. Prakash Keswani, Senior Professor SMS Medical College, Jaipur, Consultant Endocrinologist from Jaipur. I am here to give a talk on association of diabetes and thyroid. Both of these are the common endocrine problems, and surprisingly, if a person develops one problem of these, he is prone to develop the other problem. And both of these diseases are associated with each other, as uncontrolled diabetes has several effects on the thyroid metabolism, while thyroid disorders like hyperthyroidism by many of the processes can cause increase of the blood sugar level. If a person has already diabetes and develops hyperthyroidism, there is worsening of the thyroid diabetes. If a person do not have diabetes, develops hyperthyroidism, many of these persons develop glucose intolerance, means borderline diabetes, and even frank new diabetes can be identified in these patients. Similarly, hypothyroid patients have different kind of presentation, and they can have lowering of the blood sugar levels. And outcome of these patients is also related whether if a patient of the diabetes develops hypothyroidism, there are more chances of development of the diabetic nephropathy, worsening of the neuropathy. And if their patients are controlled well with the thyroxine therapy, there is marked improvement in this altered metabolism. They may have better renal outcome. Similarly, retinopathy has been found to be worsened in diabetic patients if they develop hypothyroidism. And on the other hand, if a patient has diabetic nephropathy and has development of the subclinical hypothyroidism also, these patients have also a worsening of the nephropathy. So both of these disorders affect the outcome of the other diseases. And if a person develops type 1 diabetes, there are many chances of developing autoimmune thyroid disease or hypothyroidism and even hyperthyroidism are more in those patients who develop type 1 diabetes as compared to the type 2 diabetes, because of the common etiologic or common autoimmune disease process. And thus these diseases are found to be associated with each other. Similarly, if a patient has diabetes, he has more chances of development of the atherogenosis and cardiovascular risk. And if these patients also develop the hypothyroidism as such also can cause atherogenesis, and if both of the diseases are there are more chances of development of the cardiovascular disease. So we have to take care of all the patients of the type of the diabetes for development of the hypothyroidism, and it is recommended that all patients of the diabetes at the time of the diagnosis of the diabetes should be investigated for the TSH to find out any degree of hypothyroidism, and later on also every yearly, particularly in type 1 diabetic patients, so at least we can improve the outcome of our patients. Thank you all.